Hi everyone, we're here today again at the Camboro Veterinary Hospital going over some different things and some innovative things. We've done, as you know, programs on the laser, and we've done programs on physical therapy, and we've done it on a little bit of the chiropractor also has done a program, and this time Dr. Rumble's going to do several things. We're going to give you just a little taste of various things that are done here at Camboro, and we're going to start, I believe, with a ear scope. Am I right?
That's correct. This is Felix, and Felix is an old kitty. He's about a 14-year-old guy. He's had chronic discharge out of his ear. When we did a physical exam on Felix, we found a growth that's called a polyp that's coming from down on the inside of the ear and coming right out through the canal. They can also occur in the back of the throat and go up into the sinuses, and they're nasal pharyngeal polyps, they're called.
Is that the same thing that can happen to a dog? Because, you know, Felix is very famous here. He's going to be the first cat that we're going to use on my dog and me. So Felix is important. And Emily, you're helping, right?
Yes, I am.
Okay, here we go.
Well,
so are they the same as a dog?
Well, no, a cat's ear is a cat ear, and a dog's ear is a dog ear. I had to get that in.
Thank you for sharing that.
Actually, they're very, very similar, but they're very different than human ears.
Okay.
Okay, and I'm going to just pull out a little dog skull here to show us the difference. With a dog or a cat, they have a vertical and they have a horizontal ear canal. And so this is actually coming from inside the middle ear, not in the canal, but it's growing out. They have the same structures, the eardrum, the hammer and sickle and all that we have in there, but they have one thing that's very, very different, and that's called the bulla. And the bulla is a little bowl of bone on the bottom here, and this is the ear where the canal comes into the ear, and that's an empty chamber, and that chamber is essentially a resonating chamber where when sound comes in it can be amplified. That is why we have chronic ear problems in dogs and cats, because when a dog's head is like this and the ear canal's up here and the bulla is down here, it's a bowl. And so when that eardrum is broken and it's infected, material and gook and junk collect in there, and by putting little drops in the ear doesn't do it. So we're very fortunate. We have an irrigation unit called an irrigator that we can go actually down in with the scope into the middle ear and actually flush all that material out.
Do you always do that from the outside in?
Absolutely.
You don't go in through the mouth? Go through the mouth sometimes?
No, we don't go through the mouth, but sometimes these polyps, especially in cats, will grow inside here and you can't get them out. And so there's a surgery where you go in, it's called a bulla osteotomy. You go in and essentially it's like a hard-boiled egg. You crack that and you scoop that out just like you would a hard-boiled egg out of a shell, and you leave that open, and that drains and then that heals. Our big problem there, these little holes there, those were blood vessels and nerves.
Okay.
And there's a nice big number 6 cranial nerve that goes right over top of that thing. And you don't want to damage that one, because that's pretty important as far as the eyelid moving and little things like that.
Kind of important.
So it is very important. But it is a surgery that can be done to help relieve these chronic problems in especially cats, sometimes dogs. But we're gonna take a picture with the scope. You'll be able to see while we're doing this right on the television screen the whole scope procedure. Never know what's going to happen. It may pluck out of there real easily, or we may actually have to hook the laser up and go down in there and use the laser to vaporize the tissue.
Okay, sounds like a plan.
We're just going to make sure the vein, the catheter is in, and it's going to actually flush itself.
And what we're doing is flushing the catheter, feeling the vein to make sure the catheter is in place and none of that is leaking into the wrong area. Now we're going to
Go ahead and
give the induction agent. That's the agent that sort of puts them to sleep and then permits us to put a tube
Are you filming this right now? Oh, good. I didn't know that you were. But again, we did the one to just flush it to make sure that it was okay. Is that what we're telling me in here? And now then we're putting the sedative in?
Yep, we put the sedative in, and
Okay.
I'm just flushing it to put it the rest of the way and
Empty it out.
Okay.
do the...
How long does it take? Long does it? Not
There
very
you
long.
go. That answers your question.
That was my answer to my question. I didn't even have the question out. The question was already answered. This is Mariah standing beside me now. She's helping. Is it Mark?
Mark.
And Mark on this side. And what are we doing here?
You're going to intubate with a
We're
intratracheal-
intubating, and that's where we put the tube down through the
Right.
larynx into the windpipe, the trachea, and that's so that we have an airway. Cats can be pretty tricky. Those things can go into a little spasm once in a while, and so
You have a little light there going too, don't you?
Yeah.
Yeah,
I'd need
sometimes you
bifocals
have to
for this
give
one.
more.
Open up.
Oh, it goes so well when you're on television too.
Well, you know, first of all, that this cat would have to be sedated because I have 5 cats, and you couldn't touch a cat like this on a bet. A dog maybe, but not a cat.
Okay. We may use a smaller one sometimes, or you put a stylet in to give it a little more oomph. As I say, what happens, there's little cartilages down there that quiver, and you don't want to damage them. You don't
And
want
they
to
don't
force
relax after the sedative's given?
it. Cats,
Not as much?
not as much. Dogs, it's pretty easy. Cats can, boy, they can clamp. It'll clamp right up.
Really?
Yeah, it
Huh.
can be very, very difficult. And they also, sometimes in dogs, if you have problems, you can actually paint that with a local anesthetic. Cats are very, very sensitive to that.
Now,
So-
what was that sound we heard?
That was
Air.
passing.
Oh, air, was it air passing?
coming out of the lungs.
Okay,
That's what you
because I
want to
know we
hear.
picked that up on the film, so we wanted to make sure we tell people what that was.
When that is in and blown, the cuff blown up so that no air can get around or no
Right.
anesthetic agent can come out or no fluid, like when you're doing dentistry, you don't want fluid to go back into the lungs. You should not hear them cough.
Okay, now what all are we doing here? Could I ask while we're doing this? Giving him what?
We're opening some air up to make sure the oxygen flow is good.
Oh, okay.
And I'm
And,
just puffing the ET tube just to make sure that any saliva or anything doesn't go into the lungs.
Okay.
And then I measured it to make sure that we're not actually in only one lung cavity. We're just right at the bifurcation.
Okay, good.
And then we'll hook up to a monitor, and we have what's called to keep open fluids, and that's to keep the catheter open so that we have,
He's getting a lot of attention here.
they need a lot of attention. We're under anesthesia. He's an old guy. His blood work that we did was all normal.
Okay, now what are we
So-
doing? Miles, explain this, and then you're putting a little bit of,
Putting eye lube in the eyes so they don't dry out while we're
Okay.
under anesthesia.
they do that for humans too, don't they?
Yes.
I thought they did. And what's this little cat's name again?
Felix.
Felix. Perfect name. Felix the cat.
He's a wonderful, wonderful cat.
Mark, what are you doing?
And make sure he's breathing.
And everything's looking good? Okay.
I'm going to put a little bit of this underneath here. And we're going to clip his ear. We're going to need to turn him over.
What ear are we going to be operating on here?
Yeah, let
The,
me check the record. Here, we're going to actually flush both of them. I believe it's the right ear we're flushing. Or we're doing the surgery on. It is the right ear, not the wrong ear.
and what are we connecting up now? Monitor?
Let's do that after we turn him. 2, 3.
This is pretty common with, like you said on the beginning, pretty common with cats?
You know, in young cats, they tend to get nasal pharyngeal polyps where they go up in from the throat up behind the soft palate, and that. Older cats, you see more of this. So yeah, the one in the young cats are associated with chronic allergy problems often. But you'll see them kittens. Look like an alien slug I mean, literally, it was that big out of the back of a kitten one time.
Wow.
It was, and the cat couldn't, you know, the kitten couldn't breathe. And can I have the clippers, please?
What's the story with dogs as far as, is there something with, and I've just heard this, is it down ears as opposed to up ears? That down ears have more of a chance to get issues
Well,
than the
yes,
up
you're
ears?
getting, yeah, and certain breeds in particular have more of a problem as well. Cocker spaniels, Springer spaniels, you know, have problems, but a lot of times it's in ears it's associated with allergies. We're just getting pre-up.
And we can't see this from the outside what this is?
We're gonna,
oh,
yes,
we're gonna put it on the scope. Okay,
I
good.
just want to get things out here cleaned up a little bit. And this is not a sterile surgery, but we still want to have, you know, we still want to have things clean.
Okay,
Well,
I'm going
this
to change
is
places
the,
with you, and I'm going to go over on the other side. I'm going to actually look over your shoulder, Dr.
That's
Rummel. Is
fine.
that okay?
Absolutely. I'm used to that.
Most men are.
My wife does that all
I was going to say, it's a necessity.
in a very affectionate way, honey.
Oh, yes. I'm glad you cleared that up.
Okay.
Okay, what are we doing here now? We've got the
Just
scope.
getting this scope. We're just checking it. Okay. Is this warm, Mark? Yes. Okay, I need some hot, please. We'll do this. Usually you can visualize this better with a, when it's with water in it. We'll see what or fluid, I mean. Whoa, where's that thing there? All right, we have a nice big gross. Now I'm going to warm
How far
this.
down that ear is that?
Well, we don't know.
Oh, okay.
We can see the tip of it right as it comes around that corner
Okay.
from the horizontal to vertical. Now I'm going to warm this up because when you go in there, the ear is warm, and if the scope isn't, it fogs up. Okay, so there's the polyp. See that big red thing right there?
Oh, the red
in
thing,
the middle?
right in the very center now.
Yeah.
Okay.
Okay.
How big is that actually? About as big as what? Eraser head?
Oh, yeah. Probably. There's a better picture. Pretty
Okay.
gross, huh?
Yeah, it is.
So we don't know where that's coming from yet. We just know it's there. So the next step we're going to do, I'm going to flush this ear with lots of fluid to clean it up. This has a little bit of betadine in it just to help sterilize that area or clean it as well as it can be cleaned.
So that's the fluid that you're putting in there now?
Correct. This is a flushing solution, and we're just, again, we're going to get a bunch of goop out of it.
And that just runs out freely?
It's like turkey baster.
All right.
Not really, but it's
Kind of
similar.
looks like it actually.
Yeah.
Can you get that pretty good there, Mark? Or,
It's a lavage.
Kevin?
It's for lavaging. Okay, let's just see what we look like now after we've gotten all this goop out of here.
And where'd the goop go? Just on the side?
Well,
Oh, I see
here.
it there.
Okay, so yeah, there's just big pieces of goop that's it's actually collected in behind those areas.
Okay.
Okay. So let's see what we have now going on down
Okay.
there. Very different because the solution is in there. You can see that a little more well defined now. Okay, I'm going to have Mark come over here. Why don't you go around the other side? And this is where we start playing video game.
You're probably good at a video game.
Okay, let's try it without the suction right now, Mark. I meant just we're going to try to pluck it, get down behind and... Okay. So we're feeding an instrument through the channel, and there it is down in there. We're going to move this so that we can, okay, go down deeper, please. Deeper, open. Oh, close. Partially. Okay, see what you can grab. Okay, not much.
I can't believe that you can do
Okay,
that.
open. I'm going to pull out. You stay at the same level.
When
Go deeper, please.
When you get something out, will you put that over to the left so we can
yes.
see? Okay, what we're getting out of
Okay,
there.
close. Let's see what we got. Okay. Well, we only got a tiny little piece. Can you hand me one of those white sponges, please?
I certainly can. I think I might have gotten two.
Okay, so we just have a piece of the head. Looks big on the screen and it's very small at this point. Let's
Now, how much did we get out on our first try? Just a little
not
bit?
very much. Not
Okay.
enough, that's for sure. Okay.
That bleeds?
Oh yeah,
Okay.
that'll start bleeding. That's why we want. Okay, let's try to get down at 6 o'clock if we can. Go that way and see if we can isolate the base a little better. Okay. Go right over the top. Oop, not quite. Yep. Pull back. Okay,
I'm
close.
telling you, Dr. Ron, this is
Go
like
ahead,
your,
go
this is like your
ahead.
video
Go ahead.
game
Clamp.
fix for the day.
Yes, it is. Okay, there's the, we're going to just sort of tease it. Oh, wasn't that nice?
Oh, wow.
Oh, wasn't that nice? Okay, open. So there's our, we don't know how much yet because we have to go back in.
Wow.
Isn't that fun?
It is. I'm telling you, I think it's like a video game here.
That's very, I'll tell you, it's really cool. The staff loves it when the team gets here and we pull out. See, we didn't get it, we got a lot, but look at how much is still there. So we still have to.
Now, how will you be able to, you said sometimes this goes around the corner between the vertical to the horizontal, but this is right on the,
This is right at the
right at the
bend.
turn, yeah.
Yeah, so, okay, what we're going to try to do here, turn your yeah, a little bit more so that you can.
Okay, now here's my next
Okay,
question
go.
while you're telling
Open.
him directions. What did you do before you had this ability to go in and take this with the scope that he's using? Or, not a scope, what is he using? What do you call what Mark's handling?
I got it. That's a clamp. Okay, whoop. Yeah, we have to, there's an alligator forceps I'll show you, and we may end up, sometimes you resort to that if, okay, let's try this again.
So before you had this ability, well, how did you do this?
Well, I used an otoscope, and you went down through the otoscope with these big clamps and
So
tried to
obviously
hook
this
it.
is more efficient.
Oh, well, and it's more precise. Go ahead. Clamp.
Got it. Oop, slid off.
Okay.
Mark, can you see? Well, you just know by. Does it
Okay,
feel
let's
different?
see if we can go to the base. Get around it.
Most of it's by feel.
And by trying to coordinate what you're seeing on the screen to what
open.
you're doing.
Open.
Right.
Open. Okay.
It looks so much bigger on the screen.
Doesn't it?
Whenever he brings it
Okay.
out here, it's a very,
it.
very small
it.
little instrument.
There.
Wow.
Okay. Okay.
Got some more that time?
Yes, I did. Let's hold this. I'm gonna. Yeah, we gotta. So right now, that's how big we have it. How we doing, Carol?
Kevin, can you see that? Good.
Now, why don't we? Carol's one of our nurses here. She's monitoring the CBC and the heart rate and the respiration rate and all that while our cat's on. Okay. So we're still, all that we got, we've removed, we still have a pretty good, okay, open.
A pretty big mass in there yet, isn't
Yeah. I'd like to go deep, and clamp.
And the monitors for heart rate and
Yes,
oxygen and all that?
yes. Let's flush. Okay, just hold, don't vacuum yet. Okay, let's go down, tease that a little bit and see if we can, whoop,
Will this grow back?
go ahead, it could. Well, I don't know yet. Let's see where, no, go ahead. I want you to tease behind that and see where if we can locate the base.
Another question. Are these normally, would I use the
Go up
right
there.
terminology
Go
saying they're
down,
normally
keep going down.
benign?
Yes,
Okay.
flush. I want you to try to get in behind that. with your, there. Okay, see that big chunk of pus we just flushed out of there? There's a great picture. Okay, so what I'm trying to do here is locate by flushing in behind it, find out where the base of it is so that we can maybe go down in there instead of, let's go down below.
Who's doing the flushing, you or Mark?
Mark, I'm just
Okay.
giving him instructions right
Okay.
now. Okay, so that, okay, let's pull back.
So he can clamp and take it out of there, and his instrument also allows him to flush it out.
No, this is a different instrument that we're in there. Okay,
Oh, okay.
go ahead out. Now we can suction all that out, but we don't want to because this looks so much nicer when there's fluid in there. It gives us better acuity. See that? Okay, so don't open those wide, but go ahead down now. Open, open, open.
Okay, Mark, how long does it take to learn how to do
Push
this?
that, push it down, and then, okay, there you go. A little bit closer. Okay.
A long time.
Okay, go ahead.
I was going to say,
Well, you know what? It takes a lot of time to develop the interaction.
how about
And when
eye-hand
you have-
coordination?
When you have
Wow.
somebody like me that only speaks half of what he has to understand, or Carol has to understand, or Laura, or
So the
any of
problem
them.
here is you. Is this what you're telling me?
That's
Okay.
basically what I'm saying.
Okay, we got that.
Mariah, okay, go ahead with the clamp. Let's see if we can't get the rest of that. I'm directing it, and he needs to know when I'm pulling back like that or going down. See, I'm moving that scope where to try to get him into a position. Okay, open. So I'm, okay, down deep, deep, deep before you clamp. Okay, clamp. Oh, yeah. Oh,
Mark,
yeah.
Mark, how long have you been doing this? This with the eye-hand coordination and this?
13 years.
Oh my Lord!
Long time.
Here's the next question while we're doing this. Are you a good video game player?
Oh yeah.
I would think.
Okay, let's just flush with
I
it.
would think you're probably very good at that.
He, okay, that's good. Okay, so we have some remnants down there. We're starting to get where it's,
Now, will
You
that
know.
come out by flushing it, or do you still have to
no,
go
no,
in
we
with
have
the
to
clamp?
get in. And
Tip
we're gonna, yeah, we're gonna clamp it. Open. Open.
I don't know how we'd know this, but
Okay,
will this
go
be
ahead.
painful afterwards for the cat?
It shouldn't be because I'm going to instill some stuff in the canal. There we go.
For medicine, you mean medicine?
A local. Anesthetic. Close.
Oh my Lord!
Yeah, it's pretty dramatic a lot of times when we see what's, okay, let's flush.
Is this typical for what you're seeing in there?
Yeah, and sometimes if we're lucky we can get right at the base and pluck and the whole thing comes out.
Is it because of the location of this one that was a little bit different
Yeah,
because
I
you had to
think
go
so.
around the corner?
Well, some are like broccoli, that's good. That's good. That's just
Like the top
some-
of a broccoli.
Yeah, and they have a pedunculated, a narrow stalk. Other ones are, okay, I'm going to pull back, open, go down, right next to it before you open. Okay, nope, slow, okay, good. Clamp.
Okay.
Oh, isn't that nice? Nice. Okay.
That looked like a lot.
Well, it's not that much, but it was a key part of it. See how that opened that canal up?
Wow.
Okay, so let's flush a little bit more. We have some remnants down there. Medication that we put in afterwards will also help shrink the tissue. Whoops. Now, let's go down deep. See that big chunk of, now before you flush on that, I want the camera to get this. This is really important. That material down deep there, let me take, is what we see when the ear canal is blocked. There's where it looks like that is originating from. Okay, flush. Get down in there with your, okay. Flush. See that? Look at that big pile of pus and
Oh, wow.
dried goop. Now when we get that, go ahead down in on top, go in behind it. Now watch this. Watch this stuff come flying out of there. That, oh,
Whoa.
Look at that. There's a picture for you.
That was very special.
And that's what, as I say, when the team is here and we're looking and it's like, oh my gosh, look at all that stuff. Good, flush.
And that's just coming out and
That's
running
coming
out.
out from that bola that we showed you. We're down right next to that bola. Look at that. Look at the stuff that's in there that he's flushing out of there.
Now that would have caused this other thing to keep coming back again, or
No, this is a secondary because of, look at the chunks of debris. This is from inside the ear, inside that bola.
Oh wow.
Okay, so what happens is that grows, and as that grows, it obstructs all the material from coming out of there. It gets infected, and then that bowl just fills with this. And
There's
then
a big pocket of it there.
Look at the debris so far on Felix's head that we've flushed out.
Oh,
All
my
this-
heavens.
Yeah, I mean, it's, as I say, it's very dramatic. And let's get down in there and see where how much success we've had here.
Certainly is a lot cleaner looking than it was when we started.
Now, what do we have hanging there? We're not down there all the way. Let me adjust the head. You can see the remnants of, go ahead and flush again. See that thing at the 12, up at 12 o'clock flapping in the breeze? Okay, that was the eardrum. Down at 7 o'clock where it's flapping, that's where the hole is in the eardrum. See that dark material down at around 7 o'clock?
I do.
Okay, so you have a big hole in the eardrum, and all that pus was the stuff we flushed out of there. Okay, Mark, let's start suctioning. Clean this up.
Now he can do that with his instrument. He can clean that
That's
up.
correct. All he's doing is what I'm telling him to do, so don't give him so much credit.
Oh, I wanted to give him credit.
I'm just kidding. I'm just kidding. Okay, let's flush again.
I'd like to see
I think
the-
you're gonna be really surprised at how this ear canal looks when we're done.
I think if you two were in a video game contest, I still think I'd put my money on Mark.
I think you'd probably be smart.
Okay, good.
Okay, so what we're doing now is just flushing and vacuuming all this material out of here.
And that's going into the instrument that he's using.
Yes. Okay. He's reserved. Okay. So now that
What a difference.
doesn't look perfect by any means. Let's get this stuff out of here. But as far as an ear canal, but that's because it's all infected. Here's some over here on the right. Get that.
Will that clear out more as you put the
Yes.
medication?
We're going to
stuff in?
pack this here. Go ahead. Right along the right side, 3 o'clock.
Pack it with what?
It's called Odie Pack. It's a secret recipe. I'm being serious. It has a multiple medications in it. It has a anhydrous gel base that pulls fluid out for swelling.
Okay.
It has an antibiotic. It has an antifungal, and it has a very strong cortisone in it. But we're going to infuse this first. Let's vacuum.
You'll pack it and then you'll eventually take that out later?
I'm going to infuse it first. I'm going
Right.
to show you something first. Let's see what's up at 2 o'clock there. We still have a little remnant. Very small remnant right up there. I mean 11. Let's go ahead and get your grabber. Leave some water. Yeah. So we still have up there at about 11 o'clock, we still have a tiny little remnant of that polyp. There we go. Open. So, yeah, let's turn it to the left. Okay, go down, close on it. Let's see if you can get it. See if you got it. Okay, try it again. Right along the top there. Open. Okay, close. Okay, let's take a peek. Some of this we may not be able to get totally.
How old is this cat? 6 did you say?
12. I
Oh,
think.
12, wow. Is this much more common in older cats?
This type of polyp.
Okay.
Go again. Get that air out of there.
You sure have gotten a lot of gook out of there.
Yeah. Okay. So we're going to go deep, and we're going to vacuum this ear out now. Okay.
Now, whose instrument's doing that, his or yours?
His.
Okay.
Mine, I'm just running
You're
the
just the
scope.
light.
I'm
You're just the light.
directing. No, yes. I'm the light.
So he's doing all the work?
He's
Essentially.
controlling the.
Take your catheter down and hit that polyp there up the top. See right, can you see it? Right there.
What were you going to say, Mark? He's
Scrape it
directing.
along the,
He's
scrape it
controlling everything you're seeing except that little white guy.
at the tip, okay. We're gonna have to grab that.
Yeah.
I'm frustrated here, we gotta grab that thing.
Well, that's good. I'm sure they don't always go 100% right away.
Well,
so.
no, it's gone very well. I just don't want to leave that. The medication may cause that to shrink, but I don't want to I don't want to take that chance. We don't. Go ahead, open. I'll bring that ear to you a little bit. Close. There you go. There you go. We got half of it anyway. Okay. Now we're going to suction down in the middle ear again, and then we'll. Can you get, Mariah, would you please get me some Synotic with Baytril?
You know, I don't think people realize if you
quarter
move your left.
cc of, excuse me a second,
ahead.
Synotic and 3/4 Baytril.
The tube that he's putting down actually goes down through what you're controlling. Okay. The section you have the scope.
That's
I don't know if
what
they could see that though. With, with
yeah,
your-
that's what I'm saying.
Can you see that, Kevin, where that actually goes down and he feeds it through there? I wasn't sure that everyone saw that.
So let's go down and deep and suction. Okay, suction. Okay, so we're vacuuming that all out. So does that look a little different?
So it looks a lot
Look at
different to
that.
me.
Isn't that nice? That's nice. Okay, next thing we're going to do is use this scope, and I'm going to go right down into that area I showed you through that eardrum where it's torn, and we're going to put some medication down in there for the infection. That's not for the polyp part, it's for the secondary infection. Remember that infection that there is secondary to the polyp being there. So we got the polyp out in pieces, but it's all here, and all this debris that we can see on Felix, all this will clean off, but all this gook and junk, these big chunks of pus and stuff, is actually from inside and behind that polyp. So this is just he's gonna feel so much better.
Is he going to tell you that?
He will.
I thought he would.
He'll purr, and
Hey, while you're doing
veterinarians know how to talk to animals.
I know,
We have
I
a
know you
special
do.
communication.
Kevin, go over and just get a picture of that monitor over there so that we know that. There we go. Is that better? Can you get everything there? So we know what all's going on, and we're monitoring everything that's going on with the cat right now.
Okay.
Okay,
So we're
thank
going
you.
to go back here now, and we're going to go down into. Okay. It's going to fog up. Let's go deep and just stay down around 7.
And what are we looking for now?
Nothing. We're going to be go deep.
The stuff down in there. Does he have the stuff in his?
Deeper. Okay.
Good.
Yes. He and then put air in it. Now this is medication that we're putting down into that ear, and then he's going to put just a little bit of air behind it just to. Okay. And there we go. Okay. So we are done with that. Excuse me. We'll do a real quick visual on that other ear just to make sure everything's hunky-dory here with our buddy Felix. We could do a turn him, please. There we can. Okay, clippers, please. So I know this ear's dirty. When I looked at it in the office with the otoscope, I did not see any polyp, but that doesn't mean we'll just make sure that everything's good while we have them here under anesthesia. Just to finish. Now you have to be careful with this too. If you put it in, seal it, and put too much pressure, you can actually damage the ear. So this is to just, lightly flush. Okay, here we go. This is our left ear. A little bit different. Oh, nice big ball of wax in there.
Yes. Now, can you get that out, or will that come out with the
Absolutely.
flushing?
Oh yeah, that's what That's what Mark's gonna do.
Mark's
right
gonna
now.
do that now.
Mark's gonna flush it out.
You and I are on the wrong sides.
Yeah, I
okay.
think we can
We're
flush.
switching.
I think we can flush that out. Let's use the irrigator. He's gonna need to be over here actually. Let's turn this. All righty, boy, look at that. Nice big ball of gook right there. You can just see. That's why we check both. Get a little behind it. Okay, flush. There it comes. Oh my gosh, look at that thing. Flush. I'm afraid if you flushing?
Yeah.
Wow.
It's a big one.
Okay, now let's see if we can get it with our... the problem is when you grab it, sometimes these break apart, and it's awful nice to just... Yeah, now might have to flush again. It's right there behind all that debris. Okay, flush.
Whoa.
Yeah, we should be able to bring that out. Okay, let's get in there. Yeah. Okay, looks like we're not going to flush it. We're going to get your thing and.
Now you're gonna have to try and pick this one out of there
Yeah,
too.
it's almost out. It's sitting right here. I just don't want to drive it back down in. Then we'll see what they open. Yep. See, it's going to break apart. Go ahead and close. See if you just.
Is that common for it to break apart a little bit like
Yeah,
that?
there's big wax balls. Actually, here it is. It's right there. Yeah.
Can you see it?
Yep.
Dr. Rama?
Ta-da!
Oh, isn't that pretty?
Let's see if we get
There,
that.
get another
Wow.
one of those.
That's pretty. That's pretty. That was the good ear.
Oh,
Okay, let's see what we have behind that now. You just never know. Okay, let's flush down in there. See, that looks pretty sore in that. Look at that down behind. Go ahead, flush. Go down to the bottom. See that eardrum there's ragged too. Look at that. There's just a little bit down at the bottom there. So
okay,
just
let's
touch
discuss
that.
something. How does a dog or a cat respond whenever they have
Touch
this
that?
in their ear? Is this the dog that carries her head to the side
Yeah, that's
or
good.
tips it, or the same thing with
Just
cats? How do you
vacuum.
know that?
Vacuum. That can occur. A lot of times they
Nothing.
don't show much at all. Shake their head a little bit. Usually dogs are a little better as far as
What do dogs do?
they,
Shake their
they
head?
show you more. They shake their head, rub
Carry
their
to the
ear,
side.
They carry their ear differently. So we'll just put some Otamax in that. Let me pack this ear for them, and then you guys can clean our friend up here. Well, that was pretty cool.
That was. The second one was good.
That was pretty cool. Oh, you didn't like the first
I
one?
liked the first one too, but the second one was really.
Well, that was unexpected. And again, that's, you do, I don't want to sound corny, but you do feel good because as a veterinarian and as a veterinary team, you did something.
Mm-hmm.
You can see it, you can show the owner, it's pretty dramatic. So we're going to put this packing in this year.
And Felix is a star, our only cat
Felix-
ever.
Felix is our star.
That'll be the next thing people will say, why aren't you changing it to my dog and me, my cat and me? Is it my dog and me? Okay.
Can I have some more?
People laugh,
I need
can't
some more
remember that.
cleaner Q-tip. So we'll dry this so that the packing stays in there, and this packing is like a peanut butter. I don't want to get in there and take too much of this stuff we instilled out, but it's like a sticky, yucky stuff, and it actually medicates and it stays in there for about 10 days.
That's not AudiClean. Is that AudiClean you're putting in there?
No, it's a pack. It's an
packet.
OD pack.
Okay.
We call it, but we have different types of it. But what's nice for a client, it's very difficult on some of these ears, especially on dogs, well, and cats that aren't used to being handled. Those ears are very sore, they're swollen, and so when you can put something in there that they don't have to monkey with it for a week or 10 days.
That's perfect.
It works out very, very well, and it's very effective medication. Okay, well, we're going to wake Felix up and answer any of you guys' questions. Thanks.
Okay, everybody's had a chance now. Thank you, Dr. Rummel. We appreciate that. And again, we did the flushing of a cat's ear, and we could do it basically the same way if we were doing a dog.
Right.
Again, we had Felix. We have to give Felix all the plugs we can get here. Anything else you want to tell people as far as preventative? Is there anything preventative about this that the owner can do?
Yeah, there is. As far as the ear infections go, just routine your regular wellness exams with your veterinarian. If you notice your animal shaking their head, if you feel the ear and it's hot, especially in dogs.
What about the smell?
Smell,
that's
heat,
what I
use
always
your
get.
senses. You don't have to be a doctor or a nurse or an expert to know that your dog's ear is not normal. The more you check your dog, and the more you check your cat just on a regular basis, you will know when something's not normal.
Does the cat ear also smell, have an odor just like the dog ear does?
Not
The dog ear really smells.
Yeah, not as often, but the cat's ear will plug up usually with more debris.
Okay.
So you look and it'll be a dark, and just because it's dark doesn't mean it has mites. A lot of times they'll say, oh, that's dark, and well, they must have ear mites. They don't. Now we showed on the first shows some of those scopes with ear mites.
We did.
And so they're pretty common, especially in outdoor cats and young kittens. So yeah, just have your veterinarian check things. If the ears are warm, hot, they smell, head shaking, holding the ear or the head in an odd manner. And the earlier you get it, the better. If it's just an external ear infection, that's a huge difference between what we just saw here, where that material is actually coming from inside the middle ear.
Okay, thanks very much. I appreciate it.
Thank you. Thanks for coming up.